Good morning. My name is Dr. Asad Cheema from University Maternity Hospital, Limerick. Today I will present our baseline audit entitled Postoperative Oral Intake Following Elective Caesarean Section at University Maternity Hospital, Limerick. This project evaluated our current postoperative feeding practice and compared it with the Enhanced Recovery After Surgery, or ERAS, 2025 recommendations. Slide 1. Background and aim. Early postoperative feeding is an important component of enhanced recovery after cesarean section. The ERAS Society recommends early oral intake because it reduces postoperative ileus, promotes earlier mobilization, improves maternal comfort, and enhances the overall recovery experience. Despite these recommendations, feeding practices in many maternity units continue to be influenced by established ward routines rather than written, evidence-based protocols. At our institution, postoperative feeding was guided primarily by routine practice instead of a formal protocol. Therefore, the aim of this audit was to evaluate current postoperative oral intake following elective cesarean section and compare local practice with the ERAS 2025 recommendations. Slide 2. Methods and results. We conducted a prospective observational audit of 25 consecutive women undergoing elective cesarean section under neuraxial anesthesia between the 1st and 28th of February 2026. Using a structured pro forma, we recorded documented postoperative fasting instructions, the time to first oral fluids and solids, reasons for any delay, and patient feedback regarding their postoperative feeding experience. We found that no patient had a documented postoperative fasting order. 80% of women commenced oral fluids within 2 hours of surgery, and all patients had received oral fluids within 4 hours, demonstrating good adherence to the ERAS recommendations for early fluid intake. However, progression to a light or solid diet was consistently delayed until approximately 6 hours after surgery. Importantly, 88% of these delays were attributable to routine ward practice rather than clinical necessity, while only 12% were related to clinical factors such as nausea. Patient feedback reinforced these findings. 64% of women felt ready to drink earlier, and just over half, 52%, believed that the timing of postoperative feeding could be improved. Slide 3. Conclusion and take-home message. In conclusion, our audit demonstrates that early oral fluid intake is already well established and broadly aligns with the current ERAS recommendations. However, progression to